If I teach you to fish, I'll feed you the rest of your lives. And with all the pressures on orthodontics at the moment to reduce its academic base, you've really got to learn to know what are the references that are useful and what are the references that aren't. And in addition to that, you've also got to put aside all this glossy media coverage of how we're going to advertise all these various aligner treatments in particular to say they're worthwhile. But you've got to look at things with a very objective view. And the famous saying that was said to me many times when I was put down by the QCs, Professor McDonald, do not raise your voice to improve your argument, just simply improve your argument. So let's go through the things that we can. So where's the next one? All right. So the three aims or objectives: identify the interaction of the archwire and the slot, establish the common misconceptions in orthodontic mechanics, and to identify typical issues associated with alignment. Now, it's all going to be merged into one. We're not going to have many clinical things, but hopefully you will start to ask questions yourself next time you pick up bits and pieces with regard to orthodontic equipment that in theory should be fairly standardized. You're also not going to be surprised that any academic usually talks about stuff they've actually investigated, and there will be a smattering of that. You'll also recognize one or two names, but it is really up to you as individuals to start to develop a discrimination as to which are the good names in orthodontics, the ones you want to listen to, the ones that actually have value to add. And we're looking at bracket dimensions, molar tube dimensions, archwire dimensions, and lacebacks. And why do we interest ourselves in all this? Well, obviously we want to improve our rate of orthodontic tooth movement. We want to ensure the correct angulation of the tip, and to ensure the correct inclination of teeth. It won't surprise you that I have a underlying theme that a lot of what we've been taught of orthodontics is actually not really based on that much scientific fact. We used to see patients every 4 weeks. Now we've slipped it to 6 weeks, 8 weeks. Is there a justification for how often we should see our patients? The other big myth in orthodontics that's fairly limited in terms of what data there is out there is that we're always taught, certainly as undergraduates, and I don't know that it's changed, that teeth will move at 1 millimeter a month. I'm not sure that's right, but if you think of this, 1 millimeter a month, a standard class 1 case with crowding, loss of a premolar unit in each quadrant, should take us 3 to 5 months to treat if we're efficient. If we're optimistic, we might complete treatment within 12 to 15 months. I must admit, one of the few treatments that I ever witnessed going very quickly was 9 months, and the patient had started some growth hormone replacement therapy. So are our mechanics inefficient? And if we look at this case here, you can see crowded, we're going to take out the premolars. And in theory, we move the buccal segments forwards 3.5 millimeters. At the same time, we should be retracting the canine and aligning the lower incisors 3.5 millimeters. But does that take 3 to 5 months? By all means, again, in the pyramid of evidence, lectures are probably the lowest form of evidence because they're opinion rather than anything else. And you can only really get evidence from these if you go away and think about this and actually start to apply the logic of it in your own clinical practice. So this is the first bit we're going to look at. We have the slot. Don't forget there are two sorts of bracket slots. There's 0.018 and there's 0.022 of an inch. Most of you use the 0.022, the reason being that in order to actually have the 0.018 as any value, it's a very, very precise system, and a lot of us, including myself, don't really have the precision skills to be able to use 0.022.